So on today's podcast, we have Dr. Hayes with Premier Physical Therapy and Sports Performance. Welcome.
Thank you very much, man. Really excited to be here.
Yeah, I'm excited to kind of chat with you. So I don't know if I told you this before, but I, at one point, was going towards a path of being a physical therapist.
Very cool.
Yeah, so I have a degree in biology, and then I started a master's program. And I was like, okay, I'm done. Yeah, that's enough for me.
That's fair. That's fair. Yeah, it's
it's a lot.
It is a lot. Going through all the schooling. It's a bachelor's degree, and they changed the requirements back in 2006 or so, or maybe 2009. That in order to practice, you had to get your doctorate. So it was even more schooling.
Yeah.
So about 7 total years of school.
Goodness. Yeah. That's not fun. That's like my wife. She's 9. She's a doctor of veterinary medicine. So 9 years total in school. I'm like, man,
yeah,
I don't know how y'all do it.
Well, my wife, right? So I actually contemplated shortly after graduating saying, hey, should I go get a PhD? Because so the degree I have is doctor of physical therapy, which allows me to practice. But we had a lot of our professors also had their PhD because they would do clinical research, and I was super into the research.
Yeah.
And she goes, I'd like to actually maybe have a house and a family one day. Could she maybe not be a professional student? So
yeah.
Like, oh, okay. All right. That's fine.
Let's shut this down a little bit.
Yeah.
All right. So let's start off here. Like, why physical therapy for you?
So a pretty classic story. Really two things. Pretty classic story. I grew up playing sports. I played 3 varsity sports in high school. And hoping to play at the next level, got hurt, ACL, meniscus. And then that kind of opened my eyes. I had a fantastic PT, opened my eyes to, oh, hey, this is a pretty cool profession. I get to work with people. I get to work with people who want to be active and athletic. So I had a conversation with her about, hey, what does it take to get into PT school? And then the other thing is I always, even before that, I always knew I wanted to work with people in some fashion. My father is a physician. My grandfather was a physician as well, both medical doctors. And so it's always kind of been in my blood a little bit. So combination of those two, my injury history and the rehab, and then just that family history of people who, were helping people.
Yeah.
Here we are.
Cool. So your injury, was that during college, during school?
It was I was attempting to try out. I was trying to walk on.
And that's when you hurt your knee?
Yeah. And then subsequently I did it again, playing recreational sports. So I've had a couple of pretty major injuries. But I still am competitive in like amateur strongman. I still play recreational sports. I can still run. I can still lift weights as much as I want to. I did just turn 41, so I got to kind of remind myself that maybe I'm slowing down a little bit of that. But even with those injuries, I have made myself actually stronger, in my opinion.
Yeah,
working through that, and it's given me a better resolve. But the main thing it does is I have the empathy for anyone who walks in my door.
Sure.
And say, hey, been there. I've been at some point where I wasn't sure if I was going to be able to run again, especially after my second one.
Yeah.
It was
same knee or
same knee. Yep. Yeah. But I worked through it. Fortunately used my own knowledge, to overcome a lot of stuff. And, I try to use my story to empower anyone that walks in my clinic.
Which I think that makes a huge difference. I know for me, like in real estate, like when I think it was like a year and a half in, like when we bought our first home. So like going through the experience of like buying your home, it creates like a whole different awareness and appreciation for what you're going through.
Yes. Yeah. I vividly, we've purchased, we've had 2 homes. This is our second home that we're in right now. My family, my wife, my family. But yeah, I remember it was 10 years ago going through it the first time.
Yeah.
And numbers, talking to people, and just,
right.
Yeah, man. Yeah. It's a whirlwind. So kudos. Yeah. Kudos to you for doing what you do and for guiding people through the process.
For sure. Appreciate that. And so for you, it's like like you said, like you're able to have empathy for like what they're going through, right? And understand the pain, the struggles, like the mindset of it all.
Yeah. Yeah. It's one of those, not to get too deep 3 minutes into the podcast. But I was pretty athletic. my little brother would probably say that he's more athletic than I am.
Yeah.
But, I grew up playing sports, um, and I was pretty good, right? But having this injury, it wasn't like I was going to go pro, right?
Mhm.
But
Mhm.
so having this injury kind of gave me this understanding of maybe what I'm supposed to do here.
Mm. Mhm.
And 'cause when I first happened, especially the second time, um, I was mid 20s, not really sure what I was going to do with my life. And it kind of set me on the path that I should be on, that I am on. And I wouldn't change, looking back, wouldn't change anything for the world because,
Mhm.
that led me to, meet my wife, have the family that we have right now, have the life that we do, and live in this area, which we love being here.
Yeah.
And so it was something that kind of put me on that path, and I am happy for it.
Yeah.
Yeah.
That's cool.
Yeah.
So your business, Premier Physical Therapy and Sports Performance, how long have you guys been opened now?
So Premier's actually been around for a while. I think this is year maybe 16.
Okay.
Yeah. So it was founded, before I got there.
Okay.
I started out working for bigger corporate physical therapy, and quickly got a little burned out, as a lot of young PTs do,
Sure.
because I was seeing like 3-4 people at a time and running around like a chicken with my head cut off, and people weren't getting better.
And what was your schedule like then? Like, so
So
3-4 people at a time.
yeah, for 8 to 10 hours a day.
Yeah.
So seeing 20 to 25 people a day.
Yeah.
And people, there were a lot of people who were not getting better. And I didn't know at the time. I just thought, oh, this is how it just
Yeah.
happens, right?
Yeah.
If people just don't get better. And I
Yeah.
was like, no, like there's a lot more that goes into pain than just the physical. And the having a conversation with people goes a long way. Just basically letting them tell their story, because a lot of times people just haven't been heard, and they're in pain, and they just want to kind of vent a little bit
Mhm.
and let their story be heard. You can't do that from seeing 3 or 4 people at a time.
Yeah.
So anyway, long story short, Premier Physical Therapy, I kind of looked around a little bit, and Premier Physical Therapy, we see people one-on-one every single time. And right there off the bat, like, this is awesome, right? I didn't know places like that existed.
Mhm.
So I left, joined the staff, and with the intention of purchasing the business from the previous owner. He retired, moved out of state.
Cool.
And so I've been the owner now for about 5.5 years.
Cool.
Yeah.
Congratulations.
Thank you. Yeah, man.
So what do you guys, I guess, like, what's your approach there? Has it changed much since you have owned it the last 5.5 years? Have you?
Not in terms of how we see people.
Right.
We're still one-on-one. We, my clinical staff just have doctors of physical therapy. Nothing against, anyone else, but I just want, I want the same level of experience for each and every patient appointment, right?
Mhm.
So that's our belief, is that, having DPTs is going to be a good way to do that. The type of patient may have changed slightly. I also have my USA weightlifting certification. So the Palm Harbor location is inside Palm Harbor Strength and Conditioning. So I work a lot with CrossFitters, powerlifters, because that's also the type of workouts that I do.
Okay.
And so we may have shifted a little bit to seeing more of that population,
Mhm.
people who want to pick up a weight, put it down, and they're unable to do so because of pain. But we still see our Medicare patients, our older patients. We still see our balanced patients. We still see, quote unquote, average Joes and Janes who just want to, live a healthy life and play with their kids. So we still see all those as well.
Yeah.
Yeah.
Can you, as like a practice, are there practices where you just focus on like the like strength and conditioning side, or like the athlete versus, both?
Yes. Short answer is yes. So for physical therapy, you don't have to be in pain to come to physical therapy. If you are limited, yes, pain is the main reason people come to see us.
Yeah.
But if you have a limitation in your strength, a limitation in mobility, a limitation in balance, those are all things that physical therapy can help improve. So coming back to the performance aspect of it, we can
Mhm.
still do it under the guise of physical therapy. And then I have options as well. Once we move past traditional physical therapy, we do the barbell movements. So I will do more of the performance aspect as well. It looks very similar. Like if you saw someone at their first visit and maybe at their 10th visit, it may look very similar. but we have progressed them, right? And
Mm-hmm.
so like you might actually pick up a barbell on day one. It might not be the same amount of weight that you were doing before, but I'm going to try to get you to pick up a barbell if that's what you were doing before and that's what you
Sure.
want to do, and then we progress.
Okay. So what is how do you define physical therapy? And then, maybe from my perspective, I think most people probably think that it's just like, okay, I had an injury, like you were saying, and then now I need physical therapy to get back to my state that I was in before, my physical state that I was in before.
Right. That's definitely the traditional definition, and that essentially encompasses the majority of what physical therapy is.
Yeah.
But physical therapy, especially in this day and age, especially with COVID and what's been going on, and people getting a better understanding of, oh, hey, like my fitness actually does matter for things like this. Physical therapy is also preventative, so it can be something where anyone can come in for an evaluation for physical therapy. And on that evaluation, it's our job to determine, do you have strength deficits? Do you have mobility deficits? Not just for pain. Do you have all these things that may lead you to have an injury down the line? And then
Mm,
we can prevent it ahead of time. And insurance will at least cover that very first visit. So I work with insurance and out of pocket payment
okay.
patient as well.
Okay.
But so the point being, like, if you're curious about your health,
Yeah.
a doctor of physical therapy can do an evaluation and determine if you are appropriate to come to physical therapy.
Cool. So what does that evaluation look like?
So it's a combination of it's a combination of what you may encounter if you go to an orthopedic medical doctor. So we do an orthopedic exam. So as doctors of physical therapy, our education is to be able to diagnose and treat musculoskeletal disorders. So doing clinical tests, like to determine if somebody's got a rotator cuff tear or ACL tear or just a
Mm,
good old fashioned ankle sprain. We do that examination. So I do hands-on tests for that. And then the main thing that we do is we watch how you move. So yes, you may have had an ankle sprain, but I'm going to see, all right, I want to check what your balance looks like. I'm going to see how you walk. I'm going to see how you squat if you're able to do a single leg version of a squat. And so that all, and then combined with my hands-on assessment, meaning I'm going to look at, are you lacking mobility? Does your joint stiff? Do you have a restriction in your soft tissue? And that all that stuff together combines a picture of, all right, here's a quote unquote medical diagnosis, but really we're treating these physical impairments. And so
mm-hmm.
physical therapy will then, once we get that diagnosis, say, hey, you have limited mobility. We'll do some hands-on techniques. Teach you some exercises to improve your mobility, and then improve your balance, improve your strength, and so on and so forth.
Yeah,
Yeah.
that's cool.
Mhm.
I think have you you kind of touched on this before, but the preventative side of medicine and just people being more aware now of their health and everything that really affects like your overall health. Have you seen a change in that and like more people coming in for preventative measures?
Yes,
Yeah.
definitely. Yeah, especially
Has it
people.
been like since COVID or before that?
It was so there was a definitely a shift that was beginning probably
Mm,
early when I first came out. So I've been practicing since 2012. So there was starting to be a shift.
okay.
I might have also it kind of biased my patient population because of
Yeah.
what I
Right.
do, right?
Right.
But definitely since COVID, people who were just starting to get like neck pain and back pain from sitting all day long. We know there wasn't a big serious injury, but they know their job is going to require them to continue to sit for a prolonged period of time. And so it's like they would come in, and a lot of times the story was, hey, man, it's not that bad, but I know I'm going to be doing a lot more sitting, and sitting is hurting me, it's causing me pain. Can we do something about it ahead of
Mm-hmm.
time?
Mm-hmm.
So yeah, the shift is it's been a significant increase in the last like 3 years now. Yeah.
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 Mhm.
Crazy.
Mhm.
Which is overall it's good, right? Like,
Yeah.
people are
Mhm.
being more aware and kind.
Yes. I mean, it stinks. It takes a pandemic for people to get a better understanding of why their fitness is so important. But
Yeah.
at least people are getting a better understanding.
Yeah. So let's dive into that a little bit more. Like you mentioned before, about like minimum exercise guidelines,
Mhm.
right? And like the majority of the population is not like reaching those.
Right.
Um, so like what are those guidelines? And let's talk about that a little more.
So the minimum guidelines is from the World Health Organization, and it was updated recently, I think maybe 2 years ago.
Okay.
So the whole point of these guidelines is these are the minimum requirements to help you. You know, it's not going to guarantee, but to help kind of stave off systemic conditions, diabetes, high blood pressure, upper respiratory infections, things along those lines, cancer potentially even. And so those guidelines are on a weekly basis. You need to average at least 150 minutes of moderate intensity cardiovascular exercise and 2 days of moderate intensity resistance strength training. So moderate intensity, there's a reason it's a little subjective.
Yeah.
Your moderate intensity might be different than mine, might be different than someone who's 70 or 80 years old. And that the whole point is we want people to kind of start to push themselves a little bit moderately. So what exactly does that mean? A moderate, if you were to take like a rate of difficulty on an exercise, a workout itself, the whole workout, 10 out of 10 means I was very close to going to the hospital. Like I'm on the floor and like type of thing. I couldn't do anything more. You probably want to keep that workout around like a 6 to 7, 8 maybe, right? So essentially if every workout
that's like a moderate level.
Yeah, it's like a moderate level.
Okay.
Yeah. Right. Yeah. So can you do a workout that's a 2 or 3? Sure. Right. But then you want to make sure that, hey, all right, I may need to do a little more in that 7 range.
Yeah.
And so, and it doesn't have to be, again, 150 minutes. It's not like I got to do 150 minutes in one day. It's over the course of the week, right?
Yeah.
So maybe one day is 30 minutes of gentle walking, but maybe one day is 30 minutes of, I'm going to get on the row machine and I'm going to try to kind of push myself a little bit, get my heart rate going.
Yeah.
So, here's my standard caveat or disclaimer that before anyone just hops into this, like get yourself checks. If you haven't gotten yourself checked, make sure that your heart is healthy and so on and so forth. But those guidelines are there. They're in place because they've done studies, and people who hit those guidelines have a significantly less chance of succumbing to those systemic conditions.
Yeah. Is that, and maybe you know this, maybe you don't, like, is that just a problem in the United States, or is that like a problem just like across the world, just like people in general?
It is. So it is across the world, more so in the United States. So the statistic is that even though it's the World Health Organization, but the statistic that we have, since we're here in the United States, is that 77% of Americans are not hitting those guidelines.
77%.
Correct.
Crazy.
Yeah.
Crazy.
Yeah. And my job is I don't want pain to be a barrier to you being able to exercise. So if I can help reduce your pain and you can exercise and you can hit those numbers, we've all won.
Yeah. What do you think? Why do you think that is? Like, why do you think it's like 77% like don't walk or have some sort of moderate exercise?
Obviously there's not one like, magic bullet, right?
Yeah.
But if you look at, how much time do we have? Look at the American society, right? We're a society where everyone loves driving. We have highways. We have a highway system, right? Everyone commutes. A lot of people commute to work, with the exception of these big cities. In Florida, like commute. I have a 30-minute commute to my clinic, and so if you compare that to European countries where there's a lot of walking. People can walk to their job, like Amsterdam, everybody's on a bike, right? And so people are getting that exercise in without really truly quote unquote exercising.
Sure.
So I think that's a big thing. I'm not anti-patriotic. I love America, right?
Yeah.
But it's the way they kind of our society is built. And I think that is a big, no pun intended, that's a big step in why why that number is so much higher in our country.
Yeah. So it just takes more of an effort, more like to be aware of, I need to get this exercise in, instead of just like I'm getting it in my daily,
correct,
life.
Yeah. Because it's not that Europeans exercise more than we do purposefully.
Yeah. Right.
They just, it's built into their
daily lifestyle is different.
Yeah.
Yeah. That makes sense. So what are some tips or for people who are like in that 77% and be like, okay, like this is inspiring me, like I need to get up and get moving. Like how do we get started?
Right. The easiest way is to find something that you like to do. and then that just allows you to move. And so it may be something as simple as just start going for a walk, right? And it might even be that you can only walk for 10 or 15 minutes. 10 or 15 minutes is a heck of a lot better than zero,
Yeah.
right? And so you start something there. Maybe you had too much pain to even do that. Maybe if you have access to a pool, and just getting into a pool and walking in a pool, right? Just simple things like, if you can just get up, stand up, and sit down in a chair, and just that's one of our simplest exercises that we
Yeah.
have people do is, hey, you have a chair, you sit in it. How about you stand up and you sit down,
Yeah.
and do that a few times throughout the day?
Yeah.
And so it's a combination of finding things that people are already doing, but that they also like to do as well. Because I know that I'm I'm different, right? I wake up between 5 and 5:30 every morning,
Sure.
and I get my exercise in, I get my workout, my lift in, and I know that I am in the minority when it comes to that, because I love it,
Yeah.
and there are not as many people who come to my clinic who are like that, and so
Sure.
I know that what I need to do for them is find something that they are already doing that they enjoy to do, and that's our first step in the process.
Yeah. And then, like you said, keep it as simple as possible, right? So
Yeah, in
if
the early
you're,
goings.
yeah,
Yeah, right. And so once you kind of get going, and you're able to kind of establish a little bit of a pattern, then we can start to say, all right, hey, you've done a fantastic job. You've been on a 10-minute walk every day for the last 3 weeks. How about we see if we can do a little bit of some strengthening exercises,
mm-hmm.
right? Let's see if we can tease a little bit of that in. Maybe we try to gradually increase the walking that you're doing. So it's not going to happen overnight. People aren't just going to, go from 0 to 150 minutes, in 1 week. It's going to be a gradual process.
Yeah.
So and that's kind of where we come in, to help guide people through that. It's kind of maybe a little cliche. We kind of view ourselves as like, people's Yoda, right? We're your guides
Yeah.
through the process. So to give you an understanding of, is the pain you're experiencing okay? Is
Yeah.
this something that we need to actually do something about? Is it, we call it appropriate or inappropriate? And then telling you, like, all right, here's what to expect over the next 24, 48 hours. Here are other things that we want you to do. Here is your roadmap to getting you back to doing what you want to do, or at least achieving those numbers.
Yeah. I think it's important too to have, someone like yourself, like in your corner, right? Because you could, like, the pain level, or the, experiencing pain. Like, if you're exercising and you're doing things at a moderate level or pushing the limits a little bit, you're at some point you're probably going to experience some sort of pain, right?
Yeah.
So understanding, is this good pain? Is this bad pain? Like, is this okay to push the limits on this? And that's like, I go back to like running, and every time I've gone through where I trained for half marathon, and then I back off and stop training for a while. And then I'm starting over basically. So
Mhm.
every time I start over, like, there's, I experience pain and, ankle and your knee and all that kind of stuff. Right.
Right. Then eventually your body adjusts
Right.
to it, right? So,
Yeah.
and you have more, probably a little more experience, or at least you've been there before. And you're, oh, okay, I remember this.
Yeah.
Right. And a lot of our pain comes back to how we were brought up as children.
Yeah.
If did you have parents who, every time you fell over and skinned your knee, did they coddle you and make sure that, oh, are you okay? Or did you have parents kind of like mine who were like, are you bleeding? Are you dead?
Yeah.
You're fine. Right. So, and so and now that leads into, like, all right, well, now today as an adult, I'm going to start a running program. And you may have never had an injury before in your life. And then you start to experience some discomfort because you're starting to run and you're kind of freaking out. You're like, I don't know what this is.
Yeah.
And so then, you might instinctively shut it down. And so then that is where we come in to say, hey, listen, let's talk about the pain and our understanding of descriptors of pain, the timeline of pain, the time that it takes you to recover from pain, what makes it better, what makes it worse. That's where we can come in to be your guide and say, hey, like, all right, look, let's pump the brakes. You don't have to stop running. Maybe you run a little bit less and we take a little more of a gradual approach, or, hey, maybe you actually are limited in your strength. Do some strengthening while we gradually work on the running.
Mm-hmm.
And that's kind of just an example of what it kind of looks like in a nutshell.
Yeah. Which is such a valuable resource to have, to be able to have someone to go to like that.
Yeah. I wish that, so part of the reason that I injured myself, because either I was not doing enough of some agility drills that I should have been doing. And it's a cliche, that I say, well, I wish I had somebody like me when I was younger.
Yeah.
Might have been a different path. But yeah, I mean, that's really all we try to do. I'm just trying. Yes, I have the degrees, but I'm really just trying to empower people to get to move.
Mm-hmm. Yeah, I love that.
Yeah.
And it's so simple.
Yeah,
it can be so simple.
Yes.
Yeah.
Yeah.
So I want to talk a little bit about like the business side, and like what was that experience like for you, like getting into the business? I know for you it's probably a little bit different than just like starting your own business, right? Because that was established before, but kind of like that transition for you. How was that, and what did you like about it? What did you?
Yeah, it was a big leap of faith. And I give credit to my wife and my parents. My family were a big support system that I had, to give me the confidence that, hey, you can do this. We did briefly toy with the idea of opening my own business and starting from scratch. At the time, I had a 6-month-old, and so my wife was just kind of re-entering the workforce a little bit, so it would have been tough, And so we found found Premier, and the former owner, his name was Eric Schweitzer, is very gracious and basically taken me under his wing, and so for a year he said, "Hey, listen, I'll show you what I've done to be successful," because by that point his business had been around for almost a decade. So he obviously was doing something right.
Right.
And so he said, you can take what you learn here, and then hopefully that allows you to take Premier to the next height, to the next step. And so I kind of got a crash course, and I know that I'm, it's a different experience than most people in terms of starting from ground one, from ground zero. But it still was a crash course, and I still, I'm still, my mistakes are becoming fewer and further between, but I'm still making a lot of mistakes.
Learning, right?
Yeah, exactly. Honestly, one of my biggest accomplishments was not having to close the business down when COVID hit. We're a smaller, kind of more boutique practice. I have myself, 2 other DPTs that work for me, and an office manager, and occasionally we have some part-time front office help. And so we're not a very big firm, not a very big practice, and not being able to keep everyone on my staff and not close the business down was honestly my biggest accomplishment so far as a business owner.
Yeah, that's pretty cool. Yeah. I mean, which is huge accomplishment during like, this pandemic where nobody knows what to expect next, and that sort of stuff. So to stick through that when so many other businesses close down is pretty cool. So what about the future for your business? Like, where do you see that going? Like, what do you want to accomplish there?
Well, we are hiring.
There you go.
So if there are any doctors of physical therapy listening to this podcast, hey, send me your resume.
Yeah.
So the Palm Harbor location is, I can't quite call it new anymore. I guess it's newish. It's been around for about 14 months inside Palm Harbor Strength and Conditioning.
Okay.
And I basically, what I'm trying to do is essentially scale that out, because I feel like it is a way to scale the business where it's kind of I'm a solo practitioner in that one. My Clearwater location is more of a traditional PT setup.
Okay.
But I have my treatment room inside the gym, and then I have access to the gym. And so I'll do my evaluations, my hands-on treatment, some exercise inside the treatment room, and then we get people out onto the gym floor and start working there. And hopefully I can bring someone else on my staff, but it would be a dream of mine to essentially get a little bit of a kind of like premier physical therapy satellite practices within other like-minded facilities in the area. So I, that's long-term type plans. Right now, I'm still seeing patients, still managing the business, still, trying to make my employees happy and doing all those things as a business owner, which I love. It's a great challenge in addition to working with patients. But yeah, those are the plans. I love to make it happen.
Yeah, that's pretty cool.
Yeah,
I love to hear that. So when you're not working with patients and working on the business, what do you like to do in your spare time? Weightlift?
Just kidding. Yeah, yeah. It's, I was if my wife listens to this, she'll hopefully laugh. I was having a conversation with a buddy the other day. They're basically like are four things in my life that are take my top priority in some order. My family, my wife, and my children, they're up there, right? So I go home and my kids are young. They're my daughter's almost 7. My son just turned 3, so it's a great age. And so I trying to do as much family time as I can. Other than that, it's lifting weights and I play a lot of golf too.
Yeah.
I know the two don't exactly go, they don't look like they go hand in hand, but yeah, I'm a big golfer. I've played since I was 10. That was one of my varsity sports. I was in high school. Yeah. So I love playing golf and trying to do some golf trips. So that's pretty much it. Then the business is in there somewhere as well. So
that always takes time.
Yeah. So those are, I mean, I'm, relatively simple man. I like to, I come home and enjoy time with the kids and maybe, have a nice little bourbon and just enjoy looking out my back patio and thinking when's my next tee time.
Yeah. So what's your favorite course around here?
Around here, man, I'm a big fan of, obviously around here, Lake Juvita is one of my favorites. Yeah. I know it's technically Dade City, so I don't know what the definition of around here is.
Sure, we'll go with that.
I'll go with that one, but we're specifically looking in like the Palm Harbor area. I actually do have a tee time this afternoon.
Today?
Yeah, I'm playing Cypress Run. So I have a buddy of mine who can get me out
That's
out
cool,
there. So a Cypress Run is definitely one of my favorites. We live in the Eagles, which is in Odessa.
Yeah.
And so that's also a course. That's because I can just walk right on there.
So I've played that course and they have the forest and the lakes, right?
Yep.
I know they've struggled with the condition of the course. Like, how is it now? Like, it's
getting better. It's getting better. So they've been going through, I don't want to speak out of turn too much. This is my knowledge is that they've been going through some managerial changes. Sure. And so they have, their focus has been on trying to really improve the clubhouse situation, which I think is improving. It's getting better. The condition of the course has definitely improved in the last 9 months or so.
Yeah,
they get a lot of play because they have reasonable rates, and so it's wouldn't expect too much, but it's the course design is fantastic in my opinion. And the crew out there, they're doing a good job and it's coming around.
Yeah, that's good to hear because, like you said, the design is awesome. I remember I don't know when I first started playing out there, and the course was in great shape.
Yeah,
the condition of the course.
Yeah,
and I was like, this is one of my favorite courses in the area, right? Because of the design and just being like, I like golfing because you're outdoors and kind of in the woods, and like that's like one of the places to go, right?
Yeah. Yeah, man. Yeah,
that's cool. The Eagles. Well, Dr. Hayes, I appreciate you being on the podcast and kind of sharing your story, man. Thank you so much.
I appreciate it, Donnie. This is fantastic. Thank you.
Cool.